So, how difficult can it be for a mother to travel with a newborn baby for the first time?
The first and foremost things while you're traveling is that obviously you're in a public place, so you're more likely to catch infections.
एक neck pillow baby के neck के नीचे रखना चाहिए because it helps in giving the shape to the baby's neck. So, how true is it?
So generally, as a rule, we tell people not to use a pillow for the first 2 or 3 months till the head gets a bit flat.
Hi, welcome to the Mahima Bakshi show. My today's guest is Dr. RaghuRam Mallaiah, Director Neonatology at Fortis Law Firm, and also the founder of Amara Human Milk Bank, Delhi and Bangalore. So, hi, sir, welcome to my show.
Hi, Mahima.
Great, sir. So, I have so many questions in my mind, which generally a lot of mothers, new mothers, or new fathers tend to have in their mind as well. So, my first question to you is that when the baby gets discharged from the hospital, we generally tend to say कि typically India में क्या होता है कि parents को लगता है कि baby को गोद में लेके कैरी करके वो लोग गाड़ी तक लेके आते हैं बट वेस्टर्न कंट्रीज में अगर हम देखें तो वो अलाउड नहीं होता है सो व्हाट इज द राइट वे टू एक्चुअली कैरी द बेबी फ्रॉम द हॉस्पिटल व्हेन द बेबी गेट्स डिस्चार्ज्ड
I think that's a very, very important question, Mahima. Actually, there's a lot of ignorance about this. There are a lot of myths about what is this, how is the safest way to take a baby in the car. You're absolutely right. In most countries across the world, especially in most of the developed countries, it is against the law to hold the baby in your arms or godi mein leke baithna car mein is against the law. The law is so stringent that you can even get arrested for doing that, and that is with a reason. Because when the baby is in your arms, although at home or in the hospital, that's probably the safest lap for the baby. In the car, it is not so. Because as you know, that the car is moving and there's momentum involved while you're inside the car. And even a small braking doesn't necessarily have to be an impact. Even a small braking or a sudden swerve of the car can throw the baby off from your arms. There's a lot of science involved in it. I won't go into the science of why or how much force is involved in this, but even a small baby can get thrown off very easily. And how much ever you love your baby and how much ever tightly you hold your baby, it's impossible for you to restrain your baby in your arms whenever there's an incident like this. We ourselves have seen babies who come back. Just recently, we had a mother who was just bringing the baby to the hospital and she was holding the baby in her arms. It was just a normal visit midday. She was coming from GK1 to GK2. And in that short distance, somebody came in front of the car, so the driver applied the brake. The baby flew off and hit against the windshield.
Oh my
And
God.
As it happened, they were off. Like I said, they were visiting the hospital. So when the baby came in, that I would say that the baby got off very lightly because it just had a bump on the head, and luckily did not have any serious injuries. We've had in the past babies who got thrown off have had severe cuts and injuries while they were in the arm. And again, all these are not like a proper impact or a collision that they've had. It's just nobody even thinks, you're coming like traveling 1 kilometer, 2 kilometers, and this sort of incidents have happened in the past. So it's very important to take your baby in safely. And the only way you can do that is keeping the baby in the car seat. And we can also talk about what sort of car seat you need to use, because just using the car seat per se doesn't solve the problem. You need to use it correctly. You need to fix the car seat correctly. But the only way to keep your baby safe is to use the car seat. And we ourselves deal with a large urban population, and even in the urban population there's a huge amount of ignorance and there's a lot of myths about using the car seat as well. So almost 75 to 80% of our patients, even in our hospital, don't tend to use the car seat. And there's a lack of awareness among people. And for this reason, we started this campaign known as the Safest Lap, which we've been running now for the past 5 to 6 months to increase awareness among people to start using car seats.
Great. So I think that is quite interesting because lack of awareness can really lead to a lot of, I would say, damage as well. And it's important that parents do their research properly, when the baby is being taken home. So, जैसे कि हमने बात किया that car seat is one of the safety ways to carry the baby in the car. But when we see mothers walking around with the babies, and they probably would want to like to go to the mall, or even if they are sitting in the waiting area in the hospital, they come for vaccinations. Is it okay for mothers to use the car seat as for a carrying method, even in which the baby can be kept, can sleep peacefully, doesn't have to be disturbed while carrying in the arms? So अगर हम baby comfort की बात करें, not sitting in the car, but maybe mother is walking around with the baby in the arms, which is a better option?
No, obviously, so the car seat is a good option, mainly because you can A, use it as a car seat, and B, like you correctly said, even if you're moving anywhere, if the baby is sleeping, the baby is much more comfortable in the car seat. You don't have to disturb the baby. And the modern day car seats, the ones which I used to use when I had my kids, were terrible. It was like a nightmare to buckle them in, buckle them out. But now we've got car seats which are extremely easy to fit in, extremely safe. Most of the cars are mandated to have this system known as ISOFIX. So it's just a click of a button, you can fix your car seat in. With a click of a button, your car seat gets released, and you can use this as a carry cot. So you can carry the baby to the outpatient, to the shopping mall, wherever you want, and the baby can sleep with the least amount of disturbance. So you can use it as that as well. One of the common reasons why, so some people are aware of the car seat, but most of the parents, the grandparents, and the family, extended family says to most of these people that the car seat is not a comfortable thing for the baby. Like you were asking me about the comfort of the baby. So they usually think that because the baby is sitting in the car seat, it can damage their neck, it can damage their head, the baby doesn't feel comfortable. Again, this is a huge myth that is being circulated. A baby is most safest in the car seat, mainly because the head is very well supported in the car seat. And as I was explaining to you, that when you use a car seat, you also need to, it's just not enough if you use the car seat, you need to use it correctly. So there's no point in just holding the car seat if you're not fixing it properly. So always, for a baby who's say up to 2 years, 2.5 years, you always have to use a rear facing car seat. And there's a lot of science to this, which is, in simple terms I can explain to you. Whenever there is a sudden braking or the car hits against anything, there's a forward momentum where you get thrown off forward, and that's why you get whiplash injuries. By using a rear car seat, you're actually supporting the baby's back, and as you can imagine, you're facing rear, so whenever there's an impact, your baby is going to move forward, where the back of the car seat is protecting the baby. So there's very little movement for the baby when there's an impact, and that's the reason why it's very important to use the rear facing car seat, where the baby's neck and head is the best supported. Contrary to what normal belief is among people, that the baby's neck and head is not safe in a car seat, it is actually the safest place where you can keep the baby secured.
Since you did mention about the neck support, a lot of times we also see that when babies are put to sleep, some Indian families think that एक neck pillow baby के neck के नीचे रखना चाहिए because it helps in giving this shape to the baby's neck. So how true is it? Is it actually good to use a neck pillow for the baby, or a pillow should not be used at all?
So generally when a baby is born, the head is quite pointy, and there's a slight protuberance at the back of the head. So it actually pushes the baby's neck a bit forward, and it takes about 2-3 months for the head to get a bit flat. So generally, as a rule, we tell people not to use a pillow for the first 2 or 3 months till the head gets a bit flat. And again, the logical explanation for that is, if your head is bulging and you put something behind the head, it pushes your neck forward and you're more likely to have problems with the breathing. So it's better to keep the baby on a flat surface. Of course, you can keep the baby at an incline. There's no problem with keeping the incline. So the incline should be of the whole bed or the mattress, rather than only the pillow which pushes the head forward. So you can use a pillow after 2 or 3 months after the baby is born. For the first 2 months, it's advisable not to use it.
Right. Yeah. So I think a lot of Indian parents, they tend to buy the whole bedding set, which also has a neck pillow. Yes. And a lot of parents in India, we see that they want to use a neck pillow because Absolutely. They think कि bed के साथ आया है, पूरा set है, तो हम baby के लिए पूरा set use करेंगे.
नहीं, वो सिर्फ वो not only वो खरीद लेते हैं, but it's also a traditional belief to use these rye pillows.
Rye pillows. Yeah.
So almost all parents come and ask me about the rye pillow. It's perfectly fine for them to use the rye pillow, but like I normally advise them, you just wait for 2-3 months. Till then, it's better to keep them on a firm mattress. The mattress should not sink in. It should be like a firm mattress, and the baby's head can be on that, and the whole bed or the mattress can be at an incline of about 50 to 20 degrees.
Right.
That'll keep the baby most comfortable.
Right. So we've talked about car seat, we've talked about neck support and neck pillows. What about the baby carriers? Because a lot of times parents, when they get too tired to carry the baby in the arms, they are more comfortable, making the baby be comfortable as well in a carrier. So that carrier sling, how comfortable is it for the baby? How safe is it? And from what age group onwards can it be used?
You're asking the question to the right person. I'm a big fan of the baby carrier. I myself use the baby carrier for my kids as well. It's actually one of the most comfortable thing for both the parents and the baby as well. And the important question, at what age? You can start using it from birth as well. Contrary to belief, most people feel that the baby's neck is not formed, the neck can get dislocated or can move around. That is not actually correct. The baby's neck is fully formed. The baby's neck is quite stable. The only thing is, if you look at the ratio of the baby's head to the body, it's much higher in a newborn baby, and that sort of ratio normalizes as they get into infancy or they get past infancy. So because the head is a bit heavier, it tends to wobble around a bit. So as long as you support the head reasonably well, there will be no problem. There will be absolutely no medical problem for the baby's neck or the head. So the carriers also you get in different age groups. So you just need to choose the right carrier. So there are carriers which come from 0 to 3 months as well. They tend to have a bit of better neck support, like I told you, mainly to support the bigger head of the baby. And they're perfectly safe and the baby is very comfortable in it. Obviously, after 3 months, the neck support goes down a bit. And because the baby's neck is much more stable in the sense that the baby can hold the neck much better, the muscles are developed much better. So you can use the carrier beyond 3 months as well. So there are a number of carriers which say you can start using from 0 months. Those usually the baby grows out of it by the time they're 5 to 6 months. The ones which start at 3 months sometimes go up to 9 months to a year as well. So it's perfectly safe to use it. Both the baby and the mother are very comfortable in it. At least as parents, it's very, very easy for you to carry on doing whatever you're doing, holding the baby. There's actually a very primitive method of baby carrier as well, which people used to do in rural India. They used to tie the baby using a cloth.
Yeah.
And that, I don't know whether you've seen, a lot of the laborers, a lot of the people are working. I've seen them tying the baby and doing very hard manual work. And the baby's very nicely sleeping in it. So I think it's not a new sort of science. It's been something that's been there for ages. People have been doing it. The carrier is a slightly more formal or a professional method of holding the baby in a sling.
Yeah, but I think that it's also important for parents to work upon their back strength so that they don't end up with a back pain.
Yeah, but mostly in the very beginning, it's not so much a problem. But as they get older, so you also get carriers which you can put on your back. As they grow older, you can put like a knapsack, you can put them on the back as well. That comes with a bit of a frame, so you can carry the baby on your back, which is slightly more easier than carrying the baby in the front. Yeah.
Since we're also talking about, ways to give support to the baby and to give support to the parents also to manage the baby, what about baby strollers? When is the right time to put the baby in a baby stroller, and till what age group is it okay to keep the baby in a baby stroller?
So stroller is something that you can start using once the baby's back is a little stronger. So generally people tend to use a stroller after 3 or 4 months of age. For the first 2-3 months, if you want to take your baby out to the park or for a stroll, it's better to use a pram, which is like a flat or a slightly head and elevated pram. Once they cross 3 to 4 months, then you can use more compact strollers with a little bit of back support, which has a back support. So basically anytime after 4 to 6 months, you can start using a stroller.
And till what age group is it okay to use?
So basically till the baby fits into the stroller. So a lot of people use strollers up to 1 year, 2 years, 2.5 years as well, depending upon the size of the stroller that you have. Obviously, once the baby is slightly older, they themselves want to walk and they refuse to sit in the stroller.
Yeah.
But I would say till whatever time the child wants to sit in the stroller.
So, sir, another question. A lot of times we see that, parents, they feel very bonded, attached to the baby, and they want to carry the baby in their arms most of the time. But कहीं grandparents ऐसा बोलते हैं कि इसको गोदी में लेके ज़्यादा मत घूमो, बच्चे को आपकी गोदी की आदत पड़ जाएगी, and hence you should not carry the baby in your arms all the time. So, how true is it, and which one is a better option in terms of giving more comfort to the baby?
So I'm glad that a lot of the grandparents have told this, but it's usually the grandparents who carry the baby in the godi. But I'm glad that thing has changed and grandparents are advising the children not to carry the baby in the godi. I think that's very, very sensible advice. You should never get the baby into the habit of being in the godi. The default position for a baby to be happy is to be on the bed. If you get the baby into the godi, or and one of the problems when you keep the baby in the godi is you tend to rock the baby, and that movement, the subtle movement or the rocking movement while you're walking, or while the baby is being rocked while you're walking, is very, very addictive. So once the baby gets used to it, the baby is not going to settle down to sleep on the bed. And obviously in the beginning, when you have lots of people and the baby is small, everybody comes and contributes in carrying the baby or rocking the baby, and then finally they leave it with the parents, and the parents have to take charge of the baby afterwards. And as the baby gets older and heavier, it's very difficult to do this. And to me, it's a very, very bad habit to get into. You should do as little as possible of the godi, or rocking to 100% avoided. As you might be aware that, maybe 20-25 years ago, most of the hospitals used to keep, or you might have seen in the movies, that most of the babies used to be in these cradles which used to rock. They used to deliver the baby and put them in this, and somebody used to keep rocking the baby.
Yeah.
If you come now and see, not a single hospital will keep these rocking cradles, because even the 3 or 4 days that the baby is in the hospital, if they get used to this sort of gentle swaying or rocking movements in the cradle, it's very difficult to get them to sleep otherwise. It's a hugely addictive habit for babies. They get into this habit. So almost all hospitals now only use fixed beds for babies as well. And that is the main reason why you should either not try and carry the baby in the godi, or not rock the baby. So I think if the grandparents are giving this advice, it's very, very sensible advice. I would advise all parents to follow that advice.
If we talk about flying with the baby, a lot of times what happens that there are mothers who want to kind of go do a staycation with the babies, which is fine. A lot of women do it
Absolutely.
in pregnancy.
Yes.
A lot of women do it after having birth. So how difficult can it be for a mother to travel with a newborn baby for the first time? What are the things she needs to keep in mind for air travel or train travel? And how can she ensure that there's comfort being given to the baby during the travel period?
So I'm a big fan of people normalizing their lives at the earliest possible time once they've had the baby. Obviously, breastfeeding is extremely important for mothers to continue breastfeeding. But other than that, they should try and lead a life as normal as possible, in sort of inverted commas, as much as it allows you to do. And one of the things that most people want to do, and a lot of young parents do, which I'm very fully supportive of, is they want to travel. And I don't think there's anything wrong with traveling, as long as you know what are the issues that you may have with traveling. The first and foremost things while you're traveling is that obviously you're in a public place, so you're more likely to catch infections. So that is one of the issues that you have while you're traveling. But as long as you're safe, and that's a part of life, and I don't think you can run away from it. But as long as you're safe and you're not in a very crowded place, you should be able to manage that. If you are flying, it's very important that when you're taking off your landing, that's when your baby gets into trouble. The baby needs to be suckling on something. Mostly you can breastfeed the baby, or in the worst case scenario, only for that you can get the baby to suckle using a pacifier. We don't normally recommend people to use pacifiers, but that is one of the times when you're taking off and you're landing. From a very practical perspective, if your baby doesn't want to feed at that particular point in time, then you can either give them a pacifier to suckle on, so that while you're taking off and you're landing, you don't have a problem. Like in a slightly older child, you can also give water to drink by the bottle if they're drinking, or a sipper. They can have water to drink as well. All they need to do is that sucking movement while you're taking off till you reach your full altitude, and once you start your descent. As long as you do that much, mostly you will not get into trouble. As opposed to other methods of traveling, train, I think there's nothing special that you need to do other than the fact that you're in a slightly more crowded place. That's the only issue that you're going to have with the train travel. And if you're traveling the car, like I mentioned to you, always better. Going back to this car seat business, one of the issues that a lot of people have is they tell me, my child doesn't want to sit in the car seat. And
some babies, they want to kind of get that freedom to move around, or to feel more I think open, so that when they're in the parents' arms, if they want to swap from mummy to papa, papa to mummy. But actually, that is a very bad habit, not only from a safety perspective, even from a comfort perspective, because a lot of babies start vomiting because they're moving around in a car which is already moving. So a lot of people come back and say, my child is vomiting when I travel in the car. And a lot of them don't actually have motion sickness. It is because of the positioning of the baby in the car as well. So if you get the baby to sit in one place and they sit comfortably in the car seat, a lot of people have come back and told me that the vomiting has stopped. It was not actually motion sickness.
babies very seldom get motion sickness. It usually happens after they're like maybe a year or 18 months when they start developing the sense of balance. So most of these babies are puking or vomiting mainly because of the movement within the car. So if you keep the baby still in the car seat, your baby is going to be much better off, and it may sort of overcome this problem as well. But all babies, like everything else in life, it's a question of practice. If you get your baby into the car seat the day you get the baby out of the hospital, like we discussed in the beginning, at the moment you go out of the hospital, if you put your baby in the car seat, your baby will never sit in the car without the car seat. So in most countries across the world, even if the father or mother forget the car seat, or even they're traveling on a vacation, the child will feel very uncomfortable in the car because they're not used to the car seat, or because they don't have the car seat, because it's become a part of life for them. So they think that's the only way to travel. So it's all a question of familiarity. So if you get your baby into the car seat from day one, they will be very, very comfortable, and they'll continue being in the car seat.
Great.
Yeah.
So I think this has been an interesting conversation, because generally people don't tend to discuss these kind of topics,
Yeah.
but it is important because awareness is something which needs to be there with parents right
Yeah.
from the day the baby is born. And I think every day is a learning for them. So any takeaway points for parents watching us that you would like to tell them, and make sure that they keep it in their mind?
Yeah, so like I said, Mahima, that it's important for most parents, even if they've had the baby, to continue leading a normal life. Whatever they want to do, they should try and continue doing those things. And you have to work around your way around this, as to try and lead as normal as possible, eat healthy, travel, do all the normal things that you want to do with the baby. But obviously, while you're doing this, you need to make sure that your baby is safe. And one of the most important thing while you're traveling is to make sure that your baby is in the car seat. Don't listen to the general banter which people say, the banter which they say that don't use a car seat, carry the baby in the godi. Please don't do that. It's very important to use the car seat. You can travel, you can use a baby carrier. Baby carriers are perfectly comfortable for the baby. As long as you do everything keeping your baby's safety in mind, I think there's enough technology in today's world for them to use to keep the baby safe while they try and normalize their lives out. So I think it is important for people to try and normalize what they're doing, even in spite of having the baby. Yes, like they say, a baby changes everything. Once you had a baby, it changes your life 360 degrees. But I think you should try to get back to normalcy as early as possible.
So, sir, thank you so much for sparing time. It was lovely chatting with you, and I'm so glad that we were able to discuss such important points which generally people tend to ignore. It might seem like very small things, but I think that it's a very important phase of a parent's life, and they need to know about it, that what is right, what is wrong, and they need to make sure they give the best to their babies.
It was an absolute pleasure as always, Mahima, talking to you. And I think, I hope whatever sort of knowledge I've imparted today comes into use for most of the first-time parents, or maybe even some experienced mothers as well. It's always a learning curve with babies, as you know. I keep telling most of the mothers that as your baby grows, the problem is not going to solve. The problems are going to be there, but you're going to get new problems.
Yeah.
It doesn't matter what age it is, what age you are or your baby is, those problems keep changing. So I hope this was some of the advice that I've given is of use for them.
Absolutely.
Thank you so much for watching this video, and don't forget to like, subscribe and share.